A looming shadow, the opioid and overdose crisis. This crisis has been silently growing, creeping into every corner of our society, affecting people from all walks of life. It does not discriminate. It touches the young and the old, the rich and the poor, urban and rural communities alike. Across the United States, a silent epidemic has taken hold. This epidemic is not just a series of isolated incidents, but a widespread issue that has infiltrated our neighborhoods, our homes and our lives. The streets that once bustled with activity now echo with the silence of loss and despair. The opioid and overdose crisis casts a long shadow, affecting individuals, families and communities. It leaves behind a trail of broken hearts and shattered lives. Support groups and family gatherings are now filled with stories of struggle and survival, of hope and heartbreak. This public health emergency demands our urgent attention. Emergency rooms are overwhelmed. Healthcare workers are stretched thin, and public health officials are tirelessly working to address this crisis. The urgency of the situation cannot be overstated. It is a complex issue with far-reaching consequences. Law enforcement, healthcare professionals and community leaders are all grappling with the multifaceted nature of this crisis. It is not just a medical issue, but a social, economic and legal one as well. We must understand its origins, its impact, and the paths to effective solutions. The roots of this crisis can be traced back to aggressive marketing practices and the overprescription of painkillers. Understanding these origins is crucial to finding a way forward. The crisis we face is not merely about statistics. While data and numbers help us grasp the scale of the problem, they do not capture the human suffering behind each figure. Each statistic represents a person, a family, a community in pain. It is about human lives tragically cut short. Memorial services and photographs on walls remind us of the real cost of this crisis. Each life lost is a story unfinished, a future unfulfilled. Families torn apart by grief and loss. The pain of losing a loved one to an overdose is immeasurable. Families are left to pick up the pieces, often struggling with their own feelings of guilt and helplessness. Communities grappling with the devastating consequences of addiction. Town hall meetings are filled with concerned citizens seeking answers and solutions. Abandoned buildings stand as stark reminders of the lives and communities that have been devastated. The crisis demands our compassion and our unwavering commitment to finding solutions. It calls for a collective effort, from volunteers at shelters to support group members, to policymakers and healthcare providers. Together, we can make a difference and bring hope to those affected by this crisis. Seeds of Crisis, a look back to the 1990s. This decade was a time of significant change and development in many areas, including technology, culture and healthcare. To understand the current crisis, we must journey back to the 1990s. It was a time when families gathered around their televisions, and community events were the heart of social life. The 90s were marked by a sense of optimism and progress. Pharmaceutical companies, with assurances of safety, promoted opioid painkillers for a wider range of conditions. These commercials were everywhere, promising relief and a better quality of life. Doctors, trusting these assurances, began to prescribe these medications more frequently. These potent drugs, once reserved for severe pain, became increasingly commonplace. Prescriptions for opioids surged as doctors sought to help their patients manage pain more effectively. The convenience and effectiveness of these medications made them a popular choice. The message was clear. Opioids offered relief. Advertisements depicted happy, pain-free individuals, reinforcing the idea that these drugs were a miracle solution. Patients, desperate for relief, were eager to try anything that promised to alleviate their suffering. What was less clear were the risks. The potential for addiction and the long-term consequences of opioid use were not widely discussed. Patients trusted their doctors and the pharmaceutical companies, unaware of the dangers lurking behind the promises of relief. The addictive nature of these drugs was downplayed. News reports and medical discussions often failed to highlight the risks, focusing instead on the benefits. This lack of information left many patients vulnerable to the dangers of addiction. Patients, seeking relief from pain, found themselves caught in a cycle of dependence. What started as a solution to their pain became a new problem, as they struggled with addiction and the need for ever-increasing doses to achieve the same effect. The seeds of the crisis were sown. Public health announcements and community meetings began to address the growing concerns, but for many, it was already too late. The 1990s set the stage for a crisis that would unfold in the years to come, affecting countless lives. From prescription to peril, a shift in the opioid landscape. As prescriptions for opioids rose, so too did the incidence of addiction. Individuals facing dependence turned to alternative sources. Heroin, a cheaper and more readily available opioid, emerged as a dangerous substitute. The crisis was evolving. The crisis took an even darker turn with the arrival of synthetic opioids like fentanyl. These potent drugs, often manufactured illicitly, flooded the market. Fentanyl, far more potent than heroin, increased the risk of overdose dramatically. The landscape of the crisis had shifted, becoming even more perilous. The human cost overdose deaths and shattered lives. The opioid and overdose crisis is measured in the starkest of terms: human lives lost. Overdose deaths have skyrocketed, claiming hundreds of thousands of lives. Each death represents a tragedy, a life cut short, a family left to grieve. The crisis extends beyond those who tragically lose their lives. Families are torn apart by addiction. Children grow up in households shadowed by the disease. Communities bear witness to the devastating cycle of addiction, overdose, and loss. Section 5. Ripples of loss, societal and economic impacts. The opioid and overdose crisis extends its reach far beyond individual lives. It places a significant strain on healthcare systems. The costs of treatment, emergency services and long-term care are substantial. The economic burden is immense. Law enforcement agencies are stretched thin, grappling with the illegal drug trade and the consequences of addiction. The crisis also impacts the workforce, leading to lost productivity and unemployment. The ripple effects of the crisis are felt across society. Section 6. Turning the tide: strategies for intervention. Addressing the opioid and overdose crisis demands a multifaceted approach. Public education and awareness campaigns are crucial. We must destigmatize addiction and encourage those struggling to seek help. Prevention is paramount. Stricter prescribing guidelines are essential to stem the flow of prescription opioids. Alternative pain management strategies must be explored and implemented. We must reduce over-reliance on opioids while ensuring legitimate access for patients in need. Section 7. A call for unity, collaborative action and sustained commitment. The opioid and overdose crisis is a complex challenge that requires a coordinated response. Government agencies, healthcare providers, law enforcement and communities must work together. Collaboration is essential. Sustained investment in research, prevention, treatment and recovery is crucial. We must address the root causes of addiction, including poverty, unemployment and mental health. A comprehensive approach is essential to turn the tide. Section 8. Towards a brighter horizon: compassion, innovation and hope. As the sun rises over our cities, it brings with it a new day filled with possibilities and the promise of change. In the face of the opioid and overdose crisis, we stand at a critical juncture where our actions today will shape the future of countless lives. The opioid and overdose crisis presents a formidable challenge, but it is not insurmountable. Communities across the nation are coming together, united by a shared determination to combat this epidemic. Concerned citizens, healthcare professionals and policymakers are joining forces, driven by a common goal: to save lives and restore hope. By embracing compassion, fostering innovation and maintaining unwavering hope, we can make a difference. Compassion drives us to see the humanity in every individual affected by addiction, to offer a helping hand and a listening ear. Innovation pushes us to explore new solutions, to think outside the box, and to implement strategies that can effectively address the crisis. We must treat addiction as a public health issue, not a moral failing. This shift in perspective is crucial, as it allows us to approach the problem with empathy and understanding. Addiction counseling, public health campaigns and open dialogues are essential components in changing the narrative and reducing stigma. Innovative solutions such as harm reduction initiatives offer a pragmatic approach to saving lives. Harm reduction centers, needle exchange programs, and naloxone distribution events are making a tangible impact. These initiatives not only prevent overdoses, but also provide a bridge to recovery, offering individuals the support they need to reclaim their lives. By providing access to clean needles and naloxone, we can reduce overdoses and offer a pathway to recovery. Training on naloxone use empowers community members to act swiftly in emergencies, turning bystanders into lifesavers. These efforts are crucial in creating a safety net for those at risk. Together we can build a brighter future, free from the shadow of addiction. It takes a collective effort, a community united in purpose to create lasting change. By supporting one another, celebrating successes and remaining steadfast in our commitment, we can overcome this crisis and pave the way for a healthier, more hopeful tomorrow.